Our next guest speaker is actually coming in this evening via the technology of Skype and with Eric's assistance. And he is a registered massage therapist who's been in clinical practice for over 10 years. He's also a respected member of our instructional faculty. His name is Eugene Liang, and he's in Ottawa right now, so that's why he's coming in over Skype. So, ladies and gentlemen, let's welcome Eugene over Skype.
They asked me to talk a couple months ago about this, and I appreciate the opportunity too. And I've never really said that I've been a leader in the field, or that I'm an expert or any qualified than anyone else, any of my colleagues, but I'm really privileged to have the opportunity to speak on this topic of advancing our profession. In my opinion, when I look at that topic and actually think about the topic, it's a pretty daunting topic to speak on. And when you look at the word advancement, it made me really think about the last 10 years I've been in practice, and I realized that is it advancement that we're looking for, or is it evolution that we're looking for? When you look at the two words, they're completely different words. When you look at advancement, it's actually going from point A to point B, relevant of what you do and how you get there. It's basically carry as much baggage as you want, and you can bring whatever you want, and you basically just go from point A to point B. When you look at evolution, which is what we're supposed to be doing in education, it's actually moving from point A to point B, and where you actually adapt by adding new things and actually removing old things. And I realized, given the privileges I've been given in the last 10 years in my profession, to analyze our profession, we actually haven't had that opportunity to evolve. We've advanced, we've added new schools, we've added new techniques, but we actually haven't changed anything per se. We actually haven't been able to eliminate anything in our profession. And people are like, well, why do you need to eliminate anything? And the actual thing, when you think about it that way, is how is it possible that everything we do in this profession is effective? And in my opinion, when you look at this is the actual debate. It actually comes down to this massive question of education. It's no longer this debate of 2,000 to 3,000 hours. Because in my opinion, it's actually a pretty irrelevant argument, because that argument is actually a smoke and mirrors argument to actually cover what the main problem in our education system is, which is a lack of. Like, there's an absolute lack of education in our profession. We run around as a profession saying that in the Healthcare Act and that we're a healthcare profession, but in actuality, we're not doing anything. And I mean this in the literal sense. We're not doing anything to actually advance our profession. And people are always asking, well, why do we need to move our profession forward? Why do we need to be on par with other healthcare professions? And the one thing I would say is, it's an absolute privilege to be on the Healthcare Act. But with that privilege comes a certain amount of accountability and responsibility. This accountability and responsibility is to our clients. Just like doctors and just like physiotherapists, we take more or less the Hippocratic Oath. The Hippocratic Oath, obviously, is to provide the best practice, or the best medicine, if you want to call it that, the best modalities to our clients. It's an absolute oath. It's a right that every client and patient that comes, someone who's a healthcare professional is given. They must be given that practice. And in our profession, we don't do that. Why? Because it's about this big pink elephant that's sitting in the room that no one wants to talk about, which is we are not educated. We sit around and we talk about constantly that we are, and we need respect from physios, or doctors need to respect us. And what I've realized in the last 10 years in practice is I've been told, and many of you have been told, that doctors, physios, chiros, and all these other people, and even our post-secondary education institutes, they are not respecting us like that. And at some point I realized, at what point are we going to say it's our own responsibility, not theirs, for respect? And this is where I've become extremely passionate about it, because I look at this argument, this debate, this constant, he said, she said, school versus school, veterans versus new graduates, gurus versus, whatever you want to call it.
And no one's actually looking at this problem. In the last 10 years, there have been probably a handful, or I can count in both hands, significant papers supporting the efficacy of massage therapy in any shape or form, any modality, or modalities, let's just say. In the last 10 years, there's been more papers that have disputed our efficacy. And a lot of, I try to bring this up with a lot of my colleagues, and they say, well, it's because massage therapy is qualitative or it's subjective. And I think that's just a gross understatement, or just a cop-out or an excuse to really say, we're not educated enough to actually provide the education to actually move our profession forward. Now, this sort of brings up this topic now that we're talking about here, is how people say, well, we're not moving forward with things, say, like specialization. Okay? We obviously talk about specializations now. Everyone wants to talk about specializations. It's actually coming up in the resolution with the CMT at the AGM meeting. And in my opinion, it's an absolute farce. And it's not a farce against, the CMT or anything like that, but why are we looking at specializations when we ourselves can't even do a simple thing like research literacy or research methodology, analytical thinking? These things actually help a profession move forward. Could you imagine if a doctor was a specialist in, this is a great analogy, a doctor was a specialist in open knee surgery. This doctor would be completely out of business by about 1996. It's absolutely ludicrous to think that you can actually be a specialist in a technique or a modality, because fundamentally, if you have a solid base of education in your profession, meaning you have research methodology, you have critical thinking, self-reflection skills, logic, it actually self-contains certain sort of farces like specializations and techniques, because doctors realize and physios realize that techniques are only as good as the research that's funding them or founding them. And what happens is we keep evolving, or professions keep evolving by self-evaluating their techniques. It's the same thing as why open knee surgery has become more or less a second or back or fallback technique to knee surgery, whereas arthroscopic surgery has moved to the forefront because it's less invasive and more effective. If you look at these two terms, less invasive and more effective, how can we say any of our techniques are less invasive, more effective? The only people who think they are the people who practice them. For example, I can say sports massage is definitely effective, and this person is going to come in and I'm going to do my techniques. Someone who's practicing MLD is going to say the same thing. Someone who's practicing visceral. Now, could you imagine if you went to a medical doctor for, say, something like a headache? You went to 3 doctors and you had 3 different treatments. From running the gamut of bleeding your skull to, giving you Tylenol. Yet we would expect that from another healthcare profession, but we allow ourselves as a healthcare profession to basically do a shotgun approach to every modality possible. And this, once again, is based on the fact that we don't have education. Now, if you actually look at this honestly, instead of taking looking at this 2,000, 3,000 hours, you start to realize quickly that that argument is no longer the argument. You'll always find people on two sides of the debate. You'll always find people who are passionate about one and the other. My whole responsibility tonight, and as an educator, is to give you an honest sort of view on the profession as a whole. I don't want you to take sides. I really don't. I don't want you to say, well, I'm a 2,000 person, or I'm a 3,000 person, or I'm an OBCMT person, or I'm a WCCMT person. What I want you to say to yourself is, I am a massage therapist, and how am I going to get the respect and the education that will allow me to carry the heavy burden of responsibility and accountability of the healthcare profession? The only way we can do this is to change our education system completely. And I say change in the sense that we have to look at it in a really, really critical fashion. A lot of people sit there and go, well, we can make massage therapy in a few years. Let's just use this argument really quickly. It's not that I'm on one side or the other, but sure, you can make massage therapy in 2 years purely based on skill. And then their argument is always, well, physiotherapy is a 2-year program. You can say that chiropractic is a 2-year program.